Welcome to AtlantiCare's Total Joint Replacement Pre-Surgery Education class. My name is Lauren Reese, and I am the Orthopedic Nurse Navigator for AtlantiCare Regional Medical Center. During this video, you will learn how to prepare for your surgery, what to expect on the day of surgery, what to expect while you're in the hospital, your discharge planning, and what to expect when you're home recovering. In the months and weeks leading up to your surgery, you want to do what you can to enhance your health. That includes being up to date with your flu, pneumonia, and COVID vaccines. If you are due for any of these vaccines, please make sure you get them at least 2 weeks prior to your surgery. If your surgeon has recommended weight loss, try to reduce your fat and calorie intake and make sure you're moving throughout the day, and drink plenty of water. If you are a smoker, now is the time to quit. If you need resources for weight loss or smoking cessation, you can visit the AtlantiCare website or call our Access Center at 1-888-569-1000. Also important are frequent hand washing and avoiding people that are sick. You do not want to show up to surgery feeling ill. This will only make your recovery more difficult. Needed dental work. If you have a cleaning coming up, please make sure it's at least 2 weeks before surgery and not any closer. If you need dental work after surgery, you must wait 3 months to make an appointment. What you can do to prepare your body for surgery. Exercise prior to surgery helps improve strength, range of motion, and endurance. Light exercise can include walking at least twice a day for 10 minutes and performing strengthening exercises. Not just your lower body, remember to strengthen your upper body as well. You'll need your upper body strength for getting up and out of a chair, for lowering yourself into a chair, and for walking with a walker. Healthy eating and proper nutrition helps build your immune system. Eating a well-balanced diet is important prior to surgery. You can eat foods high in iron, like lean red meats, dark green leafy vegetables, raisins, and prunes. You can also eat foods high in vitamin C, like oranges, cantaloupes, and tomatoes. Both iron and vitamin C have been proven to reduce inflammation. This diet can be helpful as you can expect to have swelling after joint surgery. Also remember to drink plenty of fluids and stay hydrated. Here is a list of things you can do to prepare your home before surgery. If you, the patient, are the cook of the family, prepare quick, easy meals and place them in the freezer beforehand. You will not want to be up and about in the kitchen after surgery, as this can cause swelling of the lower extremities. Make sure your walkways are clutter-free so you do not fall. Stairs should have railings. For 2-story homes, you're going to want to limit your trips up and down the stairs. So if you have frequently used items upstairs and you plan to recover downstairs, you might want to move them down now. Preparing your shower with a grab bar. Please make sure if you already feel unsteady on your feet in the shower, put in a grab bar. Make sure it's the kind that's screwed into the wall and not suction cupped. Locate an armchair that is not too low or too soft that you plan to rest in. Firm cushioning is better. A recliner is a good idea and can be comfortable to get in and out of after surgery. Arrange for family support and a comfortable vehicle to go home with. It is a good idea to purchase these over-the-counter medications prior to your surgery. The first is Prilosec. The generic name is omeprazole. You will be sent home on multiple medications, and these can often cause stomach upset or reflux. Prilosec is meant to reduce this stomach upset. The next is Colace, which is a stool softener. Constipation is common after this surgery, especially if you take pain medication. Pain medication is notoriously constipating, so it is important to get ahead and take stool softeners daily while recovering. You can also choose to take a laxative daily after surgery until you have a bowel movement. Finally, a probiotic. You can find this in the vitamin aisle, sometimes labeled acidophilus. A probiotic is meant to restore good gut flora that is usually depleted after surgery due to antibiotics given in the hospital and postoperatively. Prior to surgery, you will have a comprehensive medical evaluation at the Center for Perioperative Medicine, also known as pre-admission testing. This evaluation is meant for patient optimization and required for anyone going under anesthesia. The evaluation is meant to reduce complications during and after surgery. Pre-admission testing comes in two parts. First, a phone call, then an on-site visit. Your pre-admission testing phone call will be made by an RN roughly 1 month before surgery. The nurse will obtain your medical and surgical history and your medication information. Then they will schedule your on-site visit. Be prepared to provide the following: a list of your current medications, including vitamins and supplements, the name of your primary care provider, including their phone number and address. They will also want to know if you have any specialists like a cardiologist, pulmonologist, endocrinologist, etc. You will also need to provide your pharmacy's name, phone number, and location. Your pre-admission testing in-person appointment will be held at the Center for Perioperative Medicine about 2 weeks prior to surgery. We have 2 convenient locations, one in the AtlantiCare Health Park in Egg Harbor Township, the other is in AtlantiCare Health Park, Manahawkin. At your pre-admission testing on-site visit, you will meet with one of our perioperative physicians or nurse practitioners listed here on the right. The appointment is about an hour long, but please arrive 15 minutes early. Please bring your identification and insurance card. Some of the testing performed includes lab work, which is non-fasting, an EKG, a physical exam, and urine specimen if necessary. At this appointment, we'll provide you some surgical wash and instructions on how to use on the days leading up to surgery. Finally, your patient education booklet, which will have your medications listed in there and instructions on how to take your meds prior to surgery. A bottle of surgical wash will be given to you at your pre-admission testing appointment. What you'll need to do is wash with this scrub 3 times. You're going to wash 2 nights before surgery and the morning of surgery. Instructions are provided in the procedural guide given to you at the appointment. You can also click on the link below to watch a video on instructions. I would also advise you to place freshly laundered bedding on your bed prior to starting these showers, and use freshly laundered washcloths and towels after you get out of each shower. Also, do not apply any lotions, creams, or deodorant to your skin after these showers. What to bring to the hospital: loose-fitting clothes, well-fitting shoes, easy to get on and off. I would suggest a nice worn-in pair of sneakers. Your feet may get swollen after surgery, so it is important to wear shoes that aren't too tight. If you have sleep apnea, bring your CPAP mask and know your settings. Toiletries you may need overnight, your cell phone and charger, incontinence pads if needed, any special medications you're on that you know the hospital might not be able to provide. Finally, a payment for the pharmacy copay. You will be discharged with a bag of needed prescription meds. A small copay may be required at the time of discharge. Day of surgery instructions. You will receive a phone call from an AtlantiCare nurse. Expect a call between 3 to 6 p.m. the evening prior to your procedure. If your surgery is on a Monday, you will receive that call the Friday before. The nurse will tell you when to arrive at the hospital. They will also tell you instructions for when to stop eating and drinking. If you did not receive a call within the time frame of 3 to 6 p.m., please call our mainland hospital at 609-652-3430. Day before surgery instructions. Do not eat anything after midnight. That includes gum, mints, and candy. Take medications as instructed. Refer to the booklet given to you by the pre-admission testing provider. Listed on the second page are your medications and how to take them on the days leading up to surgery. Drink plenty of fluids. Get 2 16-ounce bottles of Gatorade or any sports drink. The color doesn't matter. You're going to drink one of those bottles the evening before surgery. If you're diabetic, you're to drink water or Gatorade Zero or any sugar-free sports drink. The morning of surgery, you may drink clear liquids up to 2 hours prior to your arrival time. You will drink the second bottle of 16-ounce Gatorade on the morning of surgery prior to that 2-hour mark. For example, if the nurse told you your arrival time is 7 a.m., you should stop drinking your Gatorade and all clear liquids by 5 a.m. Please avoid tea and coffee because it dehydrates, and do not drink milk products the day of surgery. Milk is not a clear liquid. Where to go on the day of surgery. Our AtlantiCare mainland campus is located at 65 West Jimmy Leeds Road in Pomona, New Jersey. If you need help with directions, our phone number is 609-652-1000. When you arrive at the hospital, enter through the main entrance and visit the front desk. They will direct you towards same-day registration. Be prepared to provide your ID and insurance card. From there, you will head to the same-day surgery unit. A nurse will take you to your pre-op room. The nurse will intake your information and provide you with your gown to change into, as well as one last surgical scrub wipe and nasal antiseptic. In your pre-op room, you will meet your anesthesiologist and your surgeon. This is your opportunity to ask any questions you may have about the surgery. Lastly, the surgeon will mark the correct limb with a marker to be sure everyone agrees on the correct surgery site. After this, it will be time to head into the operating room. If you are having a total knee replacement, a nerve block will be performed in your pre-op room prior to going into the OR. I will discuss nerve blocks in a later slide. For family members or support, the patient should designate one contact person that the surgeon will call when the surgery is over. There is a surgery waiting room with a computerized tracking system so your family can track where you are. For our waiting family members, there is a cafeteria on the ground floor, as well as vending machines. If you leave the premises to visit any of the restaurants across the street, please make sure you have your cell phone on in case the surgery team calls. Once the surgery is completed, you will recover in the PACU, or post-anesthesia care unit. A PACU nurse will call your family member if they'd like to come back and see you. After the PACU, when you are awake, alert, and feeling well, you will be taken up to the 4th floor to 4 Meadow, our musculoskeletal recovery unit. 4 Meadow is our designated orthopedic unit with 25 private bedrooms. We have a dedicated orthopedic staff specialized in caring for total joint replacement patients. While recovering, you will be visited hourly by one of our staff members to make sure you are safe and your needs are met. Your nurses will keep you up to date on your plan of the day, so you know what you should be doing in order to be discharged. Finally, for your coach or support person, please know the visiting hours, as there are no overnight stays for visitors in the hospital. For your safety, our nurses practice bedside shift reporting, which means the day nurse will report to the night nurse at the bedside to make sure each shift is aware of what went on during the prior shift. This is to ensure continuity of care. We use your name and date of birth as patient identifiers anytime we provide care or give medications. We also will scan your bracelet equipped with a barcode so that anytime we give meds, it ensures we have the correct patient and the correct medications. Finally, fall precautions. Because you were under anesthesia and you had lower body surgery, you are a fall risk. Please use your call bell before getting up. A staff member must be with you when you are out of bed. Some of the nursing care you should expect while in the hospital would be frequent assessments, including checking your vital signs and inspecting your incision and dressing. Expect to be hooked up to a few pieces of equipment when you first awake from surgery, including an IV in your arm, a pulse oximeter on your finger to check your oxygen levels, and oxygen in your nostrils. We will remove the oxygen once you are awake and fully alert. You will have compression boot sleeves on your lower legs. These are like blood pressure cuffs that lightly squeeze your calves to promote blood flow in order to prevent blood clots from forming. A Foley catheter is only placed at the surgeon's discretion and usually only if you have a pre-existing urinary history. If you have sleep apnea, our respiratory therapist will provide your room with a CPAP machine for bedtime, which we will hook your mask up to. Out of bed the day of surgery. Once your anesthesia has worn off and you have full sensation in your legs, a physical therapist or one of our nursing staff will get you up and walking and out of bed. Once you are awake and fully alert, you may eat and drink and expect to be given another bottle of Gatorade. If you are due any medications, or if you are in need of any pain medication, the nurse can provide these to you. And finally, the nurses will continuously be providing discharge education so you are constantly aware of what you should be doing to progress to home. Let's talk about pain. You will have discomfort after surgery. Our goal is to make sure that your discomfort is tolerable. Each patient will have a different level of tolerance. Even if your friend or neighbor said that they had the surgery and it was so painful, doesn't mean you will have the same experience. And conversely, if your neighbor told you that their surgery was a breeze, that may not be your experience either. Pain is individualized, so listen to your body and your body only. But know that surgical advances have reduced the amount of swelling and pain after joint replacement. We use a multimodal pain approach at AtlantiCare, which includes ice, elevation, anti-inflammatories, nerve blocks, etc. Your nurse will often ask you what your pain level is on a scale from 0 to 10. Many patients find a 3 to 5 range tolerable. Notify staff when your pain becomes severe, and notify staff if you have any side effects at all, like nausea and vomiting. Patients having a total knee replacement will receive a nerve block with a medication called Exparel. A nerve block is like getting a Novocaine injection in your gums before getting a tooth pulled. It's meant to numb your knee and make you feel more comfortable after surgery. You will be anesthetized during this procedure. The medication is injected around specific nerve bundles in your operative leg. This is performed in the pre-op area before your surgery. Exparel helps to reduce pain in the knee for up to 72 hours after surgery. The goal of the nerve block is to reduce the use of narcotics for pain control. While you are recovering, you will be visited in your room by our team of caring physicians and practitioners. Our medical co-care doctors, the same ones you would have seen in pre-admission testing, will manage your general health. This is especially important if you have pre-existing conditions like diabetes, kidney disease, or heart disease. They will make sure you are safe and healthy enough to be discharged. Your surgeon will also see you after surgery, and if you stay overnight, the surgical physician's assistant will visit you in the morning after. A physical therapist evaluates all total hips and total knees after surgery. A one-to-one individualized plan of care means they will tailor their session to what your needs are at home, so please take note of your home setup now. They will ask you how many steps, if any, to get into your home. Do you have a second or third floor? How many steps to each floor? Do you have a full bath or bedroom on the first floor? Be prepared for questions like these so that the therapist can help you prepare to navigate your home when you're discharged. The physical therapist will walk you around the unit, show you how to climb a few sets of stairs, show you how to get on and off of a toilet and in and out of a tub or shower. They will also show you some exercises you can do at home to help mobilize your joint. They will also show you how to properly use a walker and cane. If you already have a walker at home that you want to use, just make sure it's the kind that has 2 wheels on the front and 2 posts on the back. You can bring the walker with you to make sure it is sized correctly. If you do not have a walker or cane, one will be provided to you upon discharge from the hospital, as long as one was not already provided to you through insurance in the last 5 years. A case manager visits joint patients as needed. Their role is to discuss discharge options, assess your home layout, and assess your family support. Services can be provided on an individual basis only when indicated. The case manager confers with the physical therapists, nurses, and doctors for a final discharge plan. They obtain any insurance approvals needed for specific discharge services. Discharge planning. Our team of therapists, nurses, case managers, and physicians will collaborate to determine your best options for therapy and discharge based on your needs, your insurance, and your ability. Planning for discharge. Advances in surgical technique and medications help with faster recovery and earlier mobilization. Most patients go home the next day after surgery. We as a team want to get you discharged home as soon as possible, back to your natural environment where you are most comfortable. There's no place like home. When you are being discharged, the nurse will provide you with a few things, including your prescription medications, a prescription for physical therapy for total knees, and a walker and cane if you don't already have one. The nurse will remind you about your follow-up appointment with your surgeon, which is generally at 2 weeks. You should already have this appointment written down in your surgical paperwork. Please notate the date on your calendar. Finally, the nurse will instruct you on how to care for your incision at home. Discharge to home. For hip surgery, your only exercise is to walk. Generally, you should walk every hour that you're awake. Just a short walk around the house, like going to the bathroom or grabbing a snack in the kitchen. Then sit back down to rest. Anytime you're at rest, make sure to elevate your legs and ice your extremity. For your safety, please make sure you are using a walker for at least the first 7 days after surgery until you feel fully steady on your feet. You can use the walker for longer if you need to. For knee surgery, you will be provided exercises to do while at home to help get full flexion back in your knees. You are also required to walk. Again, just short distances around the house, then sit back down to rest. Elevate your legs and ice your extremity. Knee patients need to go to outpatient physical therapy 2 to 3 times per week for a few weeks. Your surgeon will indicate when you should start. Make an appointment with a PT company of your choice that's close to home and takes your insurance. You can even call ahead and inquire about openings prior to your surgery. Home PT can be requested with a case manager only if necessary and if your insurance covers it. When you are discharged home, it is important to remember to keep your circulation moving by doing ankle pumps and walking as much as possible. Again, walk every hour that you are awake, just a short trip around the first floor of your home, and sit back down to rest. Please walk with your walker for the first week post-op, and be careful not to overwork yourself or else you will swell. Apply ice to your joint, 20 minutes on and 20 minutes off throughout the day while awake. Elevate your legs when at rest. Knee patients should elevate with the operative legs straight, meaning do not place pillows under your knee. Placing pillows under the knee will promote a bent position and will heal this way. So remember to keep your legs straight at rest. You can place a pillow under your ankle if you like, as this promotes a straight knee at rest. Eat a healthy, well-balanced diet. Again, foods high in iron and vitamin C are great for inflammation and wound healing. Also drink plenty of fluids. We recommend 8 8-ounce glasses of water per day. When can I shower? You can shower as soon as the day after surgery or post-op day 1. Your dressing will be waterproof. Do not scrub your incision. Allow the water and mild soap to run down your incision. Rinse and pat dry with a clean towel when you come out of the shower. Do not apply lotions, ointments, or creams to your operative leg. Also, do not submerge in a bath, hot tub, pool, or ocean until your surgeon approves, which is generally when your incision is fully healed and closed. If you are instructed to wear an ACE bandage for a few days after surgery, just remove the ACE before showering and reapply when you get out. Pictured here are 2 different types of dressings that are most often used after surgery. If you have a Prineo dressing, shown on the left, this dressing will be removed at your follow-up appointment in 2 weeks. If you have the Aquacel dressing shown on the right, you will be removing this dressing yourself at 1 week post-op. Some things to expect after surgery. Bruising is common and expected. Bruising may appear around the incision or even down the entire leg to your ankle. It may take days to appear and may take days to go away. Mild redness around the incision is also normal, but if the redness enlarges or becomes particularly tender and hot, then it may be a sign of infection. Call your surgeon if this occurs. Now we will go over 3 potential complications after joint surgery. The first one is constipation. How do you prevent constipation? You should drink plenty of water, increase your fiber intake, limit pain medications, and take stool softeners like Colace daily, and take a laxative daily until you have a bowel movement. Some examples of laxatives are Miralax, Metamucil, milk of magnesia, and magnesium citrate. If you are past the point of an oral laxative, you can try a suppository or enema. Please call 911 if you are not passing gas and have severe abdominal pain and vomiting. The second complication is infection. How do you prevent infection? Frequent hand washing, keeping your incision clean and dry, and drinking plenty of fluids. If you are prescribed oral antibiotics after surgery, please take the full course as prescribed. What are some symptoms of joint infection? Increased redness, swelling, warmth, or a red streak near the incision. yellowish, cloudy, or bad-smelling drainage from the incision, a fever of 101.1 or higher, or as directed by your healthcare provider, and a tired feeling that doesn't go away. Symptoms of a bladder infection include burning and itching upon urination. Please call your surgeon or primary care doctor if you are experiencing any of these symptoms. In the future, please remember to call your surgeon for prophylactic antibiotics before any dental, GI, or other invasive procedures. Your surgeon will determine how long you will need to use prophylactic antibiotics before procedures such as these. The last complication I'd like to discuss is blood clots. How do we prevent them? The use of compression boots in the hospital, doing ankle pumps, walking every hour, and medications. You will be sent home on an anticoagulant. Commonly, we prescribe aspirin 81 milligrams twice per day for 30 days. These will be in your prescription bag upon discharge. Blood clots can come in two forms. First, deep vein thrombosis, or DVT, which typically starts in the lower legs. The symptoms include pain in the calf or thigh, redness in the calf, swelling, a temperature above 101. If you are experiencing any of these symptoms, please call your surgeon or primary care doctor to report it. And the next is pulmonary embolism, or PE. These are blood clots that land in the lungs. Symptoms include chest pain, shortness of breath, lightheadedness, and rapid heartbeat. If you are experiencing any of these symptoms, please call 911 immediately. When can I drive? You are not to drive until your 2-week follow-up with your surgeon. At your follow-up, your surgeon will let you know when you can begin driving, usually within 2 to 4 weeks, and when you're no longer taking pain medication. Prior to driving, you should practice getting in and out of the car and pumping the gas and brake pedals. Make sure you are comfortable behind the wheel before you drive. That concludes our total joint replacement pre-surgery education class. If you have any further questions, you can visit our AtlantiCare website. You may call your surgeon's office, refer to your total joint replacement FAQs in your discharge instructions, or you can call me, your orthopedic nurse navigator, at 609-748-4068, or email me at lauren.reese@atlanticare.org. On behalf of AtlantiCare, I want to thank you for taking the time to watch this educational video and for choosing AtlantiCare for your joint replacement surgery.